Welcome to another question and answer session. This is the physiology portion. Which of the following statement relating to the pharmacology of the warfarin is untrue? That means which of the statement is not true, or which is the false regarding the warfarin. Here are the options. It interferes with clotting factor 2, 7, 9, 10. It may not clinically effective up to 72 hours. The half-life of the warfarin is about 40 hours. Warfarin has large volume of distribution and it is metabolized by the liver. So now we have to find out details information regarding the warfarin. First of all, here we can see the warfarin. Warfarin is an oral anticoagulant. There are different type of anticoagulant, but the warfarin, it is an oral type and it inhibits reduction of the vitamin K. It inhibits reduction of the vitamin K and it is active hydroquinone form and acts as a cofactor of formation of the clotting factor 2, 7, 9, 10. So this point is very, very important. First of all, it is the 2, 7, 9, 10 the important mnemonic is 1972. So 1972, it is mnemonic. That means the 1972, sorry, 10972 or 27910. So 27910, these three important clotting factor, it action was influenced by this warfarin and also the protein C. Protein C is another natural anticoagulant. So warfarin acts on this 2, 7, 9, 10 and protein C, and it inhibits the reduction of vitamin K. That means it increases the life of the vitamin K in the blood. So it is in short about warfarin. Among these 2-3 important information, one of them is the clotting factor 2, 7, 9, 10, protein C and vitamin K. So vitamin K, factor 2, 7, 9, 10 and protein C, these three are most important information from this slide. Now the protein warfarin factors that may potentiate warfarin, that means factor they can potentiate or increase action of the warfarin. One of them is the liver disease. It is known to us that the warfarin, it is metabolized by the liver. So any liver disease, in case of liver disease, warfarin is not metabolized and warfarin present longer time in the blood, so it duration of action increase. Then P450 enzyme inhibitors, drugs such as the amiodarone and ciprofloxacin. So amiodarone and ciprofloxacin, they can increase the action of the warfarin because the warfarin, it is metabolized by this enzyme. Then cranberry juice, certain drugs such as this is NSAID, which displays the warfarin from the plasma albumin and inhibits platelet function, NSAID. Now some important side effect of the warfarin, one of them is the hemorrhage. Hemorrhage is one of the important side effect because it is an anticoagulant. So when the dose increases or inappropriate amount of warfarin orally taken, in this condition there may be hemorrhage develop, and teratogenic effect occurs in case of pregnancy and skin necrosis also develop. Another important information, when warfarin is first started in biosynthesis of protein C is reduced. This is resulted temporary procoagulant state after initially starting warfarin, normally avoided by the concurrent heparin administration, and thrombosis may occur in venules leading to skin necrosis. And what factor affected by the warfarin? It is the 2, 7, 9 and 10. It is the 2, 7, 9, 10 and it interferes with the fibrin formation by affecting the carboxylation. That means the warfarin, it acts anticoagulant by preventing fibrin formation in coagulation pathway. Factor 2 has the longest half-life, approximately 60 hours. The warfarin, its half-life is about 60 hours because the warfarin, it is bound to the plasma protein. So when a drug bind to the plasma protein, it releases less amount, so its half-life increases, and it can take 3 days of warfarin to fully effective. So in case of emergency condition, first 3 days usually supplemented by other injectable anticoagulant. Warfarin has a small volume of distribution. This point is very important. Its distribution is very small volume. That means the drug usually release very small amount in the blood because most of them are protein bound. So as it is protein bound, so their volume of distribution is relatively very less. So from this slide, 27910, fibrin formation prevention, half-life 60 hours, and it requires 3 days or more for it is fully active. It is a small volume of distribution and it is protein bound. So this information very important regarding the warfarin. So our final answer is now ready. Which of the following statement relating to the pharmacology of warfarin is untrue? That means which is false. Here the warfarin has large volume of distribution. It is not true because it is known to us that the warfarin, it has a small volume of distribution. Why? Because this warfarin, it is highly protein bound. So when it is bound to protein, it is less amount release and volume of distribution is very less. On the other hand, other options here, it interferes with clotting factor 27910. It is true. It is mnemonics is 1972. 1 means this is 10, 9, 7 and 2. It may not clinically effective up to 72 hours. That means 3 days. So it is also true that the warfarin, it may require 3 days or 72 hours to fully functional, and this time we should provide an short acting or immediate acting anticoagulant for desired action. The half-life of warfarin, it is about 40 hours or more than 40 hours. It is about 60 hours. Warfarin has a large volume of distribution. It is a small volume and it is metabolized by the liver. It is also true. And if any liver disease or any condition which affects the liver, in this condition the action of the warfarin increase because it is that time it is not possible to metabolize the warfarin in the liver. So this is all about the warfarin. I think it is clear, and warfarin is very important for any type of exam in different type. Thank you all.